Do not know me. My name is Selena Sackman. I am on the provider relations team here at Accountable Health Partners. So here is today's agenda. We are going to review some AHP staff updates. We have a partner with us today. Medline will be giving a presentation and update, data coordination update, the rollout of the new provider engagement report. We'll have an update on the 1115 waiver program, our upcoming incentive payments, and then if we have time at the end, we will have some discussion. So first off, our AHP staff updates. AHP will be saying farewell to Elisa Stetzer. She was the Senior Director of Care Management here at AHP, and we wish her much success in her future endeavors. And next up on our agenda, we are going to turn it over to Medline. And we have Mary Kozak here who is going to be sharing some slides. So I'm going to stop sharing and then Mary, you can take it over.
Thank you. Very nice to meet everyone today. Bear with me while I switch screens. Let me know if everyone could see the screen.
Yes.
All right, perfect. Let me try to put it in presenter mode. Can you guys see it, or is it the split screen?
We can see it.
Okay, beautiful. I will go ahead and get started. As Selena mentioned, my name is Mary Kozik. I am on our corporate account side that oversees the Medline AHP relationship. I also have on here our local reps, Roberto Martinez and Dan Smith. They are the boots on the ground. And when Molly and Selena let us know of providers that are willing to work with Medline and hear about our program that we have with AHP, Roberto and Dan are able to go on site to meet with the providers. So why Medline and what is the partnership that Medline has with AHP? A little bit about Medline. We are a manufacturer and a distributor. We are based out of Northfield, Illinois. We have 50 warehouses across the country. We have one local to the AHP providers, our B36 warehouse in Rochester, New York. We oversee and service the whole continuum of care. So from the acute space all the way to patients at home. From that model, we manufacture over a multitude of products, whether it's exam gloves to drapes and gowns to durable medical equipment. So we're able to pass that savings along to the site level. And on the screen, these are just some of the products that we see in the physician's office space, and we are able to help drive savings for you all. Of the products listed on the screen, Medline distributes over 500,000 products today. And again, we source locally in that B36 warehouse and stock for our large health systems like University of Rochester, but we also break it down on a LUM basis. So you don't need to buy pallets of exam gloves or pallets of exam paper. That makes Medline a bit unique in the market for you all. One of the things I want to just discuss and what Medline has been doing with our partners today on the news, and it's changing rapidly, the tariff impact. So I'll pass these slides along also after this presentation, but just wanted to give the team a bit of an update on what's happening with tariffs and what we're seeing from our partners and our competitors, and it's a fluid situation. So one of the pieces here on the screen is, as President Trump has delivered a slew of tariffs, how it's affecting the medical supply market. And you'll start to see as of July 1st and August 1st, a lot of manufacturers have been incurring these tariffs and the cost increases. So we're looking for ways at Medline to help the end users mitigate those cost increases and really looking at supplies that we're able to multi-source. So Medline does manufacture a lot of our PPE products here in the States. We manufacture textiles in Lithia Springs, but you could see on this map some of the ways Medline has been able to mitigate that with the tariff increases. 26 different manufacturing plants in the US today. And we're also continuously looking to bring those manufacturing plants to the US. We're constantly investing in new capital resources. If we're not manufacturing, looking for ways to do that. Any questions from the group, or have you seen tariff impacts today? And again, working with Dan and Roberto on a site level basis to look for ways to mitigate those. Exam gloves are a big one right now that I'm sure a lot of sites utilize from China. We are multi-sourcing, so we manufacture in Malaysia as well to help drive down those costs on the nitrile exam gloves. All right, moving on, just some different ways and platforms that Medline has access to. So medline.com is the platform that we utilize for our AHP sites today to place orders. Roberto and Dan are able to help build formularies. You could look to see what other AHP sites are buying from Medline today. And we are more than happy to run, the top few thousand items that the University of Rochester is giving access to pricing for AHP today as well. If you want to price shop or just look for different alternatives, or if your sites are seeing back orders, we see a lot of supply constraints within the last year when it comes to needles and IV solutions. So definitely more than happy to work through those back orders and look for alternatives for your sites. Some of the things too, I just want to note on that customized catalog GPO contract details. So Medline partners with AHP and Vizient to help drive some of those more significant savings on the national brands and leveraging some of our local resources there. So happy to help that in that area too. Some of the partners that Medline works with today in the Northeast outside of University of Rochester, Mount Sinai, Geisinger, NYU. So a lot of their supplies that they're utilizing today too, we're warehousing in our Northeast branches. So if there's something in B36 we don't have stock, we could leverage our C54 Montgomery, New York warehouse or our C40 Uxbridge, Mass warehouse to get you supplies next day. So looking year to date at what the AHP sites have done with us, I know there's over 95 plus sites with AHP. For the total spend, we have seen 72,000 year to date. That includes your lab, your capital, your med surge. And then I broke this down a little bit for those lab items, the clinical. If your sites test with the Cepheid, with Abbott, with Roche, with BD, Medline's agnostic in the lab market. We work with a lot of those manufacturers and could help secure some lab LVCs. Or if you guys are doing lateral flow testing, more than happy to look at the different panels that are out there and put them on a one-stop shop platform for you. Capital, Medline has a robust capital program where we work with Midmark, Welch Allyn, just to name a few, if you're doing any renovations. And then we could also tie some of that capital spend into Vizient contracts to drive additional savings. On the pharma side, we're seeing a little over $8,000 in spend in your injectables and vaccines. Medline is also able to help source different contracts and drive savings in this spot. We have 31 sites today purchasing from Medline. And something I really like to talk about is that fill rate, something Medline is very proud of. For the sites that we're servicing today, 100% of those items are coming out locally out of that B36 warehouse. Would we see that adjusted fill rate if it's at 97%? We're tapping into those 49 other warehouses that Medline has across the country to drive that fill rate up. This is just a quick snapshot of the testing platforms that we're seeing or other items across AHP, the 32 sites that are buying today. We see some lead tests, influenza as respiratory season is upon us coming mid-July, definitely leveraging the different BD or Abbott platforms that we have. And you'll see some more urine tests. But what we don't see on here, and Medline is the leader in, is exam gloves. As I talked about with mitigation strategy and the increase with tariffs, this is something I'm sure it's everyone's top spend that we could definitely help drive savings for that AHP sites. Any questions collaboratively from the group that they've seen or questions on of Medline items that we could provide to the sites? Please feel free to raise your hand, speak out.
And feel free to pop a question in the chat. We can facilitate that as well.
Molly. And then this breaks down, and we're going to go over this when we meet monthly with Selena, Molly, and Bob, just looking at the top sites from AHP that are spending with Medline and breaking down to the previous spend difference. We have the ability to run monthly reports for the sites if you want to look for outliers. We have cost savings opportunity reports that we could run monthly also for the group. I'm sure it's site specific on the different needs, but a lot of reporting capabilities to help drive savings.
Mary, we do have a question in the chat from Anne. She's wondering if there's a place on the website after logging in that would confirm that we're receiving AHP pricing.
Yes, I could, after the call, Molly, I'll send a screenshot that would show, you'll see a green check mark under the item that it says contract, but I'll send a snapshot afterwards, or Dan or Roberto, if you don't mind putting that together in one email for any of the other questions, but we could bullet point out anything.
Perfect, and we'll include that with the slides.
You got it. Outside the med-surg items, Medline actually started out as a textile company. So we have a robust portfolio of different scrubs. We're able to monogram them with your logos on there. These are also manufactured in our Lithia Springs warehouse in Atlanta, Georgia. Lead times are 7 to 10 days, so they're pretty quick. So if you're looking to put a scrub program together, Roberto and Dan are more than happy to bring a scrub kit to your sites if there's a need for that. Also, I know we're coming to the end of flu pre-book season, and I know Roberto was able to meet with some sites, but we work with Securus and Santa Fe on competitive pricing for the flu market for pre-booking. Securus starts shipping in August, and Santa Fe will start to ship in September. So if you still have a need for your flu pre-book, we're more than happy to send over pricing for your sites if that's something you want to look at. Also, Medline does distribute the COVID vaccine as well from Pfizer and Moderna. So if you guys are doing for your pediatric sites, we carry that ultra frozen, or we carry just the general stock COVID vaccine too. So we have access to that for your sites. And then, as mentioned, the point of care testing, Medline agnostic in this space, but we work with a variety of manufacturers, Roche, Abbott, Quidel, BD. So if you're looking to bring on a few different lateral flows onto one platform as respiratory season's approaching, also lead. We also have a few other different testing platforms outside of respiratory and a dedicated lab specialist in the area. His name is David, and I could provide his contact as well. He could help build a suite program for you guys. Capital Furniture. I know Roberto met with a site early this morning as they're looking to bring on a new renovated whole floor. So we work with your big manufacturers like UMF, Midmark, Welsh Allen, Amico. We also have an interior design team that will help lay out all of your plans if you provide the blueprints. And one of the unique things too is that we will go line by line and let you know what's on the Vizient contract and tie that back to the Vizient spend for the team. We also have white glove services. So for some of the smaller sites, if you don't have a maintenance team on site, we're more than happy to coordinate a white glove team to come out, house everything for any big projects, and come on site for the go live and put everything together and haul away any old products as well. Any questions? Right. Just some of the next steps that we've put together, site visits. So with over 90 plus sites, as AHP is constantly growing, we'll send these slides out. But Roberto and Dan, if you don't mind putting your contact information in the chat for the AHP team, Selena and Molly, every week are sending us different leads and opportunities for Roberto to go out and meet with, and Dan as well. So we want to make sure that we're in person assisting you guys on a daily basis. I did just speak about the flu pre-book, but this is open until the end of June. So if this is something that your sites haven't pre-booked yet, more than happy to send over the pricing structure. Tariff mitigation plan for the sites that are seeing cost increases. Please loop our team in. Happy to look to source from our multi-source manufacturing plants across the North America into Mexico, into Malaysia for different opportunities to help drive that savings. And then, is there a question? Sorry, I saw someone come off mute. No. And then one of the last pieces I wanted to offer, as sites are seeing increases, Medline is offering a 10% Medline brand rebate running until the end of the year. So please work with Roberto and Dan on anything, especially on the gloves spot, to look for and drive additional savings. That is all I have for the team. Sorry, I talk quick, but I want to be mindful of the time crunch and everyone's schedule. Please feel free. Let me know if you guys have any additional questions, or Molly or Selena, if anything is in the chat for the team.
Anything. Thank you so much, Mary. And if there are folks on the call and you think of something at 4 o'clock this afternoon that you didn't mention today, certainly reach out to Molly or myself, and we can connect you to the Medline team.
Thanks so much, Molly and Selena and Bob, for including us.
You're very welcome.
Have a great day, everyone.
Thank you, Mary. Please, I'm going to put
you.
one more plug in here. Anybody who joined a little bit late, just please remember to put your name and your practice in the chat so we can make sure to get you credit for spending your lunchtime with us.
Thank you, Molly. So next up on our agenda is an update from our data coordination team. So we are going to turn it over to Elizabeth Sharp, our Director of Clinical Operations and Quality Improvement, for that update.
Thanks, Selena. So this is very brief today. I don't even have slides, which is unusual for me. But just wanted to let everyone know, give you a little bit of context. And this is actually primarily for our pediatric practices. We have a contract with Monroe Plan, which is a subsidiary of Molina. We've had it for a couple of years, and we're revamping it a little bit this year. It's a smaller population. The volatility that you find in that smaller population makes the risk a little bit more challenging. And so we're looking at more of a gap closure opportunity this year. One of the quality measures that we are focusing on is that well child 3 to 21, which is a really, really large age range. And we are leveraging our data coordination resources in this contract. So pretty easy to do so in the adult space where we've had data coordination previously. We haven't had data coordination partnering with our pediatric practices yet. And so I just didn't want it to be a surprise. If your practice has patients on this contract, has gaps, our data coordination team might be reaching out to have a conversation with you and your docs about how we can work on this patient population and get those patients in together. That could look something like having our data coordinators call the patients for reminders. It could look something like providing a patient list. We have no preconceived notions about this, and we're trying not to step on toes. We know that the well child visits are really very much the bread and butter of our peds practices, and you guys know how to get those patients in. I just want to make sure they don't slip through the cracks. So because this is new in this space, I just didn't want it to come out of left field. If you have patience, we will be reaching out to schedule some time to talk through options and see if this is something that you're willing to partner on. That's all I got. Really easy today. Selena, I think you said something, but I couldn't hear you.
Can you hear me now?
Now we can, yes.
Wonderful. All right. So, are there any questions for Elizabeth before we move forward?
All right. Thanks, everybody.
Thank you, Elizabeth. Next on our agenda, we are going to turn it over to Kevin Kelly, our project manager for business operations, to give us a highly anticipated update on our provider engagement report rollout. So I am going to stop sharing my screen and Kevin is going to take it from here.
Thanks, Selena. Good afternoon, everyone. Just going to share my screen. Kevin Kelly, Project Manager at AHP. I will be your contact for the Provider Engagement Report dashboard. And it's a brief update, but an exciting one nonetheless, like Selena talked about, the very anticipated new rollout of the quality measured dashboard within the PER. I'll be talking about the communication coming soon, the upcoming training sessions, and a little preview of the dashboard itself. So you can expect a outreach coming soon regarding your practice's current user list, kind of who we have on our end of, who currently has access to the PER. And then we're going to also offer an opportunity for you to request new users with a new automated link, make it easier for anyone that needs a new user, and obviously any step-by-step instructions regarding how to set that up and other communications regarding that new user setup. In the communication email, you'll also see training dates that we're going to offer you in a few week window, and then outline a step-by-step process of how to regain access prior to the training. And in that, you might notice if you haven't logged into the PER, there wasn't really a need to log in because the new data is not in there yet. So there is a 90-day expiration without logging in. So again, you can expect a step-by-step process of how to regain access prior to the training. So we'll get that all squared away before our training session. In the training sessions, we will be covering the new features, which is the quality measured dashboard, which is amazing, and how to track your quality outcomes and be able to drill down into patient data, and any support documentation and any other support contacts that you'll need in case you run into any trouble within the PER. We'll also cover the data schedule and when you can expect anticipated refresh data. That'll be, also expectations of when you can see that and how you can log in and when you'll see that refresh data, which is exciting. And now I will go on to the next slide about the dashboard preview with the new quality measure dashboard and the PER data updates. So just a refresher, you can access the PER through the Accountable Health Partners Network website. In the top right corner, the PER login, and then you can access it with that yellow call to action button, provider engagement report. And within this, just the new feature is the quality measure dashboard, which is very exciting for the pediatric practices because they might not have been excited to log into their PER because they didn't have any pharmacy incentives. So the pediatric offices can now access the quality dashboard and be able to track their performance, and the adult practices. And then you can always, as always, check in on the citizenship, the pharmacy, and depression data as well within the PER. And you can expect that data to be turned on for 2025 prior to your training session. Just wanted to make that clear. If you log in today, again, you might not have access, and we can you can expect this step-by-step instruction in that email. Moving on to the most exciting portion of my presentation, the actual preview of the quality measure dashboard. Big shout out to Tyler and the whole IT team for putting this together. This is the summary view of the quality measure dashboard linked within the PER. You can drill down into patients, but it's very intuitive and easy to navigate this summary view. And you can see the different measures on the left-hand column, the measure filters and the patient filters and provider filters. You can drop down and filter through that, which is very exciting. On this screen capture, you can see the adult measures, but the pediatric measures are below, and this will be all custom to your practice and specific to your security level. Whether that's a provider, you'll only be able to see your provider data, or if you're a practice manager, you can see all of your providers within that practice. And then the next view you can see within the quality measure dashboard is the patient list, and it's just a drill down and you can select a specific measure. Right now I have selected for a pediatric practice, the 15 to 30 month visits and the patient gap list breakdown by that selected measure, which is very exciting. You'll be able to export these patient lists and drill down and be able to expect when that last appointment was and when the next appointment is going to be. I went pretty fast through that, but if there's not any questions, we'll cover most of that. We'll get into the weeds during our training sessions, but we're very excited to launch this and looking forward to the rollout.
Thank you, Kevin. Does anyone have any questions for Kevin on the PER rollout before we move on to our next topic? We've received our log of information for the PER. Do you see that, Kevin?
Yeah. So we will be able to send that out per practice. Your login information, you'll probably have to reset your password, like I said, and that'll be step-by-step instructions within that email of how to reset your password. And if there's any issues, I'll be your contact to how to access that if you're having issues. So more to come for sure. Lots of details to come.
Okay, thank you, Kevin. So next we are going to move on to Nikki Spring, who is going to be discussing the New York State 1115 Medicaid waiver program.
Thanks, Selena. Can you guys hear me okay? Oh, there we go. Sorry, I was frozen. So I am Nikki Spring. I am one of the supervising care managers on the pediatric team. LJ and I have been working closely with Kevin Kelly and Robin McElligott to diligently move forward with the waiver project and the social care network engagement with AHP. If you want to go to the next slide, Selena, we just wanted to quickly review kind of our partnership options. And these are things that everyone on this call has already known. We just kind of wanted to refresh everyone that there were 3 options that each practice was able to select, and that was option 1, you guys were going alone. We were not going to be involved in that, and you guys were going to work directly with FLIPA. Option 2 is that there was this shared responsibility that the practices would use the identified tool and enter that into the platform, and then AHP would partner with you to navigate the eligibility for care management and other services. And then the option 3, which is that AHP would take on all of those responsibilities in terms of patient screening, identification, determination of eligibility, and care management moving forward. And so that's not new information. That's just a review of kind of level setting where we are now. And Selena, if you want to go to the next slide, these are kind of the things that people are probably more eager to see. We are excited to say that our team on AHP, thanks to everyone who's on this call from AHP and some folks who are not here, we've completed our initial phase of training, and that's kind of where I've been more involved. Kevin Kelly is the project manager for this, and so he has done some of his administrative completion of training, and we are we've been granted, access to this platform. Tomorrow, Kevin and I are sitting with our FLIPA contact to build practice-specific profiles for those practices that are in option 2 and option 3. And we are really eager to see what that gives us. We're going to be seeing for the first time what our AHP unique profile looks like. And that will really give us a nice place to start from moving to the next step of piloting. And so we've been in contact with some pilot groups, and I've been the primary contact with those folks, and that's somebody in option 2 and option 3 about what it will look like for us to start piloting screening and collaboration using this platform that is new to everyone and developing a process for reporting on referrals and reporting back about patients that have been screened, whether those are successful screenings or denial of screenings, just participation overall. So for the rest of the network, just in thinking of timeline, in early July, we're hoping to have a communication out about what we've learned from our pilots and what it will look like in terms of AHP support moving forward. And we're really hoping to work together to learn about what those workflows will look like to support helping practices to be informed about a plan for receiving information about who's been screened, who's not been screened, what that process looks like. And we want to do that to provide some insight and also to fulfill those PCMH requirements, which we know is really important and essential to all the practices in this partnership. A portion that's not contained on this slide that I just wanted to mention is that for those folks who have chosen option number 1, we will be reaching back in July as well, just to make sure, how are things going? Do you have any questions? Do you continue to have any needs that perhaps you didn't anticipate? We are still your partners, and we kind of want to continue to be in communication about that. We also had some ongoing questions about for those practices who had independently contracted in the option 2 area with FLIPA. Our understanding is that is still a great thing to do. You guys are going to continue in that pathway, that there's no need to execute another contract, and that we'll continue to be in communication about how best to support that and continue to work on our partnership and the flow of information moving forward. So I don't know if based on that, folks have questions or if there's any information that we didn't cover. Selena.
Thank you, Nikki. Yes, we're not seeing any questions as of now, so we will move forward and talk about our upcoming incentive payments. So first quarter 2025 clinical integration payments should be out summer of 2025. And our 2024 PCP reward plan payment is set for August or September of this year. And now we would just like to open it up for discussion. If anyone has any topics or things they'd like to bring to the group, feel free to do that now.
And I do want to remind everybody, I know it's hard to kind of bring up questions in the middle of a meeting, but we do welcome in between these practice manager meetings, feel free to email me or Selena or anybody you feel comfortable with at AHP, and we can add them to a list and just facilitate a conversation amongst each other at our next September meeting.
Thank you, Molly. All right, so I'm not seeing any points of discussion in the chat. So our remaining meeting schedule for the rest of the year, next practice manager meeting will be September 17th and then December 10th. Again, we have them during the lunch hour, so you can spend your lunchtime with us. And your final reminder, as always, yes, we are an AHP partner participating provider. So what that means is that your practice will refer patients to AHP specialists when possible, admit patients to AHP hospitals, and send patients to AHP imaging and labs. For your practice, monitor that provider engagement report, which is coming soon, attend practice manager meetings, accept, read, and share AHP communications, especially that Pharmacy Pearl point of information that's well shared. And then just help providers connect with other AHP resources when given the opportunity. This is just a list of your contacts here at AHP. Feel free to reach out to anyone and our other contacts for our partner programs that we offer. Any final questions or thoughts?
Tim, I see your question in the chat about an update on Health Catalysts. We probably want to take that offline since we don't have Christy on the line right now to provide. I don't want to give any misinformation on our end. So we can take it offline and we can email about it.
Thank you, Molly. So we just would like to wish you a very happy and healthy summer ahead. We will see you in the fall, and take care, everyone.
Thanks, everyone.
Thank you.